My name is Dr. Paul Lorenc. I'm a board-certified aesthetic plastic surgeon practicing on Park Avenue in Manhattan, New York City, and you are watching Plastic Surgery Live.
I'm 34 years old and I'm trying to research some procedures, and it's just so hard to get good information out there. And you're here and you're telling the truth and telling it like it is, and I just really appreciate it.
So, Doc, we know that the holy grail for anti-aging medicine, the holy grail for at least, as far as aesthetics is concerned, is to be able to create your own collagen, to kind of reverse the aging process naturally with your own cells. Now, I know that you're working with Lviv, and I actually happened to see one of your videos on YouTube, and that's, to me, this is probably one of the most intriguing aspects of the future of aesthetic plastic surgery that I've seen in a long time. Why don't you tell me about it?
Well, I think you're absolutely right. I just gave a lecture this weekend to about 150 residents and fellows here from the Northeast in plastic surgery and dermatology. And that was exactly my point, that the future is really about regenerative medicine, whether it's growth factors derived from platelets, whether it's stem cells derived from fat, or whether it's fibroblasts that contain growth factors derived from the back of your ear. Right now, the technology is just the beginning of this technology, but that's the future. And what I do with Lviv, which is made by FibroCell, is in effect what I do is I take a biopsy from the back of the ear under local anesthesia, very straightforward. The fibroblasts are sort of harvested from the skin. It's sent over to the lab in Pennsylvania, and the fibroblasts are grown in tissue culture. Fibroblasts then are cultured over and over again, and then they are sent back to me with obviously very carefully labeled with the patient's name and all of the data. Then the patient is injected with these fibroblasts. And in one little vial, which contains a cubic centimeter of suspension, you get 18 million fibroblasts, which is amazing. Once injected, they stimulate your collagen production. So this is the ultimate, really, in self-regenerative medicine, and it is the future.
Well, what's amazing to me is, and I will tell you, that I've been following this company for over a decade. Now, the company has kind of restructured, and I know there were some issues in the past, but I found this fascinating from the beginning. I've been in the hair world for a long time, and I kind of, when I first read an article about the company back then, it was called Aeshetic. Right. I kind of thought that maybe we could somehow relate this to potentially, doing something in the hair world. So I was really, really excited about it, and I watched how things kind of transpired. And when Lviv was approved, and I think it was approved in 2011, correct me if I'm wrong.
That's right, and it was approved or cleared by the FDA for nasolabial fold injections, which is very interesting because, of course, anywhere else that it's used, it's an off-label use. And really, in my practice, 90% of what I do when it comes to fillers or even agents such as Lviv is in an off-label use. The FDA, yes?
Well, that's an interesting distinction that I want to make. Everything that I've read says that it's been approved, but FDA approval and FDA clearance are two different things. So has it been FDA approved or FDA cleared?
Products such as fillers are considered devices.
Right.
Lviv is also unique for that reason, because it is a biological, so it is approved by the FDA, versus injectables such as fillers are cleared by the FDA, and they really are cleared for marketing purposes.
Exactly, and that's why I thought it was important to make that distinction. This is an actual FDA-approved product. So they're not only trying to get a product cleared, and the process of clearing a product is so much different than the process of approving a drug, for instance. It's a lot easier to get a product cleared. I'm sorry?
It's a much more complex process, much more expensive to the manufacturer, of course. It's a much more complicated process. And even drug approval, as you know, it's thousands and thousands of patients versus a clearance of a device, for instance, an injectable device can be achieved with 100-patient group of patients pre and post injection. The other point that I just wanted to make, especially with Lviv, because I do believe that it's a fantastic product. yet it is used majority of the time in an off-label fashion. And what that means is that it's cleared for the nasolabial fold injections, but my favorite injection is whether it's the tear trough to sort of eliminate that hollow underneath the eye, and it's also used. I use it for acne scars, and it works beautifully for those two indications.